Hi everyone, I am Dr. Krishna Reddy Tadori, consultant endocrinologist from the Medical Hospital, High Tech City. So we are all observing World Diabetes Day on November 14th. This is a day where Banting has been, he has born on that day. So we are celebrating November 14th as the World Diabetes Day. So Banting has been contributed to the, he is the one who is behind the discovery of insulin. So almost 100 years back, he has been worked for the development of the insulin, and he has succeeded in developing this hormone, isolating this hormone from the dog pancreas. So we are celebrating this day as his birthday, as his World Diabetes Day. So you see the world, there is a lot of diabetic patients in the India. Almost 7.7 crore people have been suffering with the diabetes. So the most worrisome thing is almost 3.5 crore of people are living with diabetes without having the knowledge they are suffering with the diabetes. So we need to take care, and we need to routinely test for them to have the diagnosis, because majority of the diabetic symptoms have they are not very vague. So majority of the symptoms, they are mild fatigability, weakness, and excessive thirst, and excessive urination. So some people will feel these symptoms for months to years together without having a proper diagnosis. So there is a delay in diagnosis, and the obesity plays an important role in having the diabetes. So because there's a as the evolution progressing, the more and more accessibility to the calories are increased, and expenditure have been decreased. So when there is a increased calorie intake and decreased the expenditure, so this will all will accumulate as a fat. So this will lead to the obesity and accumulation of fat over the abdomen. So this causes the insulin resistance. So accumulation of fat over the abdomen and viscera. So the visceral organs like liver, pancreas, and the skeletal muscle, all this can be affected with the high fat accumulation, which leads to the which releases a lot of inflammatory mediators, so which will lead to the insulin resistance. So people with the lesser insulin reserves, they will manifest with the diabetes early. So this obesity is a pandemic because a lack of activity, sedentary lifestyle. So majority of the people have having the access to the high calorie carbohydrates, and high fat content foods, and saturated fats, and empty calories. So they are increasing the calorie contents, and stress works, and late night eating. So all these are all contributing to the obesity, and this insulin resistance, and other metabolic problems. This obesity not only leads to the diabetes, that will also leads to other complications like sleep apneas, hypertension, cardiovascular diseases, and some types of cancers. So you need to focus more of changing in the lifestyle, like doing more of exercise, and cutting down the calories, especially carbohydrates and fats. You need to cut down, and you should expenditure more calories. So many people will ask about what is the best way to having a good breakfast. So the breakfast should contain a low amount of carbohydrate, because in the early morning hours there is a high amount of anti-insulin hormones, which can lead to hyperglycemia. So you need to cut down the carbohydrates and fats in the early morning hours. So you need to focus.